Hey guys, Dr. Ash here with a down and dirty quick video on contagious diseases. I apologize if you hear a little Rizzo in the background. He's super excited to be on camera today. So if you hear the dog, just know that he's happy. But contagious diseases, of course, there are thousands of these, right? They're all over the place. But the ones that we're going to focus on today is going to be measles, mumps, rubella, pertussis, and chickenpox. Maybe not necessarily in that order, but we'll see here in just a minute. But again, down and dirty, contagious diseases, here we go. So let's start with rubeola, which is also known as measles or the M of the MMR. It is caused by the paramoxovirus. Incubation period lasts about 10 to 20 days. And patients are typically infectious or communicable. You may see one or the other terminology when it comes to when I can pass this on, but they're either infectious or communicable for approximately 10 days, usually about 4 to 5 days before the rash shows up and about 4 to 5 days after the rash has appeared. And so, as you can tell, 4 to 5 days before the rash, your person may be feeling okay, but this is why it's communicable, right? Because we can pass it along without even knowing that we're even infectious long before the rash even shows up. Transmission, usually respiratory secretions, contaminated blood, contaminated urine. And so most of the time we're looking at either a droplet or airborne precautions, depending on your facility. Most places will go with either but airborne to be safe. And so let's talk about assessment findings for these patients. In general, they're going to have fever, malaise or tiredness, chorza, which is kind of that red ringed eyes, a cough, and some conjunctivitis with usually without any drainage. Then we also have the classic rash, if you will, that starts on the face, and then as it progresses, it will move down the body. So again, the rash will start out on the face and then will work its way down. Then they also have what's called Koplik spots, which are actually white spots or white dotted spots on the inside of the cheeks or the buccal mucosa. So very classic of AKA measles. And so what do we do about that? We're putting them in an airborne room, okay? Like we talked about, most facilities are going to err on the side of an airborne room, and it's going to require N95 mask. We want a nice, quiet environment. We want to make sure we give plenty of fluids. And then last but not least, most of these patients are going to receive vitamin A. Okay, so vitamin A, if that shows up on any of your testing, whether it be the NCLEX or whether it be something else, vitamin A tends to reduce mortality by about 85%. Not that the 85% would be on any sort of testing situation, but understanding that as a nurse, if I give vitamin A, I can actually improve the outcomes of these patients. Rubella, also known as German measles, so measles, mumps, and rubella. I believe I have mumps next, but anyways, it's caused by the rubella virus. Fun fact: incubation period can be anywhere from 2 to 3 weeks. And people are infectious again and or communicable approximately 12 days. So we're talking about 4 to 5 days. I think it's more 5 days prior to the rash showing up to 6 to 7 days after the rash has shown up. So again, patients very contagious, very infectious, very communicable, whichever word you want to use. Just before the rash appears, you can infect somebody and not even know it. And then, of course, for up to 7 days after. Words, transmission, respiratory secretions, blood, stool, and urine. And then, of course, those infected droplets. So patients are typically on droplet or airborne precautions. So assessment findings, again, we have that fever, we have the malaise. This time we have a pink rash. With the other one, it's more of a red rash. A pink rash that starts on the face, then spreads throughout the body. And then we have petechiae, or those red hemorrhaging dots that we talk about, right? They're not like full on hemorrhaging, like lots of blood, but they're little spots of blood found on the soft palate of the mouth. Okay, so regular measles, white Koplik spots on the inside of the cheeks, and rubella or German measles, it's going to be those red dots on the soft palate. For our top interventions, airborne precautions, 100% isolate from a pregnant woman because rubella is extremely toxic to a fetus. And then, of course, lots and lots of fluids. Mumps, which is kind of the last in this lump of measles, mumps, rubella, is caused again by the paramyxovirus. Incubation period again is about 2 to 3 weeks. Infectious or communicable, contagious, whatever word you want to use, is immediately before their glands, their lymph nodes, and their glands begin to swell. Transmission happens to be through the saliva or direct contact and or droplet. And fun fact, MMR starts to be given at around no, not at around. It starts at 12 months of age. I don't know why I said around, but anyways, so the vaccines for MMR will start at 12 months. All right, for mumps again, the symptoms pretty much still stay the same, right? Fever, headache, malaise, loss of appetite. They also go just a little step further of having lots of jaw and or ear pain. It can even be ototoxic, so mumps can actually cause a temporary or permanent loss of hearing. Interventions, airborne and droplet precautions. Patients should be on bed rest. We want to avoid any chewing, crunching, hard types of things because that's going to exacerbate or make the jaw pain even worse. And then, of course, alternating heat and cold to help with the discomfort in the face. Next, we have chickenpox or varicella. It is caused by the varicella zoster virus. Incubation period is about 13 to 17 days, so it really kind of percolates inside the body for a long period of time. It's infectious slash communicable, transmittable, whatever word you want to use, for about 7 days or until the lesions, which erupt and ooze, until they begin to crust over. So basically what's going to happen is the patient presents with this widespread rash. It gets diagnosed with chickenpox. Those blisters are going to open. They're going to ooze or weep secretions for a little bit. That is their highly contagious period. And then those lesions are going to begin to crust over. And once that crusting begins, they are no longer contagious. Okay. Transmission, respiratory secretions, so airborne and contact precautions. And chickenpox is another vaccine that begins at 12 months of age. Assessment, not too much different from the other ones we talked about, guys. Fever, malaise, loss of appetite. The only other thing is that chickenpox tends to be a macular rash on the trunk. Very, very itchy rash on the trunk. So that's usually number one. Interventions tend to be strict isolation. Oftentimes we will give the varicella zoster immune globulin. Oftentimes that helps boost immunity if the patient has been vaccinated. Okay. Key point here. Immune globulin is no bueno or no good if the patient has been unvaccinated. So again, just keep that in mind when you're talking about some of these communicable diseases. And then supportive care. And basically what we mean by that is just fluids and reduce the fever and just kind of generally make them feel better. We don't use aspirin in children, so be very careful with the type of pain or fever reducer that we go with. Okay. The other thing is that this sometimes can be treated with acyclovir, which is a type of antiviral. However, we don't spend a whole lot of dosing when it comes to children. So just be aware that because chickenpox is a varicella zoster, it is a herpes type of infection. Acyclovir can also be given in certain situations. And then lastly, we have pertussis or the whooping cough. And so this is caused by Bordetella pertussis. Incubation period can be as little as 5 days or as long as about 3 weeks. And they are infectious pretty much anytime they have secretions. So they are contagious the entire time they are infected with the whooping cough. Transmission, respiratory secretions all day long, so usually droplet and contact precautions. We do begin vaccinations at about 2 months. One of the things that we have seen with pertussis in healthcare is that there has been an increase in infection rates because we've kind of had a shift in the thought process that vaccines are bad. And so we have quite a bit of population that are not vaccinated against certain communicable diseases. They get on an airplane. All they have to do is be on an airplane with someone else who's never been vaccinated, coming from another country, or infected themselves. And next thing you know, we have an outbreak of pertussis. So we have seen quite a bit of cases of pertussis or whooping cough simply due to lack of vaccines. But again, here in the United States, it starts at about 2 months. And then the last thing, the last thing we're going to talk about is our assessment findings. And pertussis really starts out like a regular respiratory infection, cough, cold, congestion, etc. And increasingly, we find that the cough just gets worse and worse and worse. And so it is caused by a bacteria. So, of course, if we don't treat that bacteria, it just continues to get worse and worse and worse. And so it will eventually turn into a loud whooping, or a lot of people have called it a seal bark, whichever the case may be. It turns into that on inspiration, and it sounds very, just a very deep cough, very miserable. These kids tend to be. So on our interventions, we typically will do droplet or airborne precautions. We are airway all day long, right? Because most of these are babies or small children that get infected. We know that small children and babies, infants, they tend to have smaller airways. And so when that gets inflamed or it gets full of mucus and congestion, they can lose their airway. So suction and humidified oxygen. Make sure we have plenty of hydration, and then of course treat with antibiotics. All right, guys, so that is it for that portion of infection, and I hope you have a great day. Make sure you like, share, and comment, and I will see you in the next video.